Okay, so hello everyone. Hope you're doing well. It's been a while since our last presentation. So today, inshallah, our topic will focus on left main coronary artery disease. Therefore, before we begin the presentation, we must understand the trajectory of the left main coronary artery. And I would like to share an image illustrating the course of the left main coronary artery. So the left main coronary artery originates from the left coronary sinus, as you can see here, of the aorta, which is the first part of the aorta where the coronary artery arises. It's typically bifurcated into two major branches, which are the circumflex coronary artery and the left anterior descender coronary artery. For the plan, we will begin with an introduction followed by a discussion on the prevalence and risk factor of left main coronary artery disease, the causes, explore diagnostic, both clinical manifestation and diagnosis modality, and move on to treatment option for the left main coronary artery disease. Finally, we will conclude, inshallah, by a conclusion. So for the introduction, the left main coronary artery disease remains one of the most daunting territories for cardiovascular surgeons and interventional cardiologists, giving it pivotal role in supplying blood to the left ventricle. In a right dominant circulation, it supports 75% of myocardial blood supply, while in a left dominant circulation, it sustains the entire left ventricular blood flow, underscoring its paramount importance in cardiac function. For the prevalence and risk factor, we have the incidence first. The left main coronary artery disease is relatively rare, accounting for about just 5 to 7% of all cases of coronary artery disease. The common risk factor includes smoking, high cholesterol, high blood pressure, diabetes, and family history of heart disease. Now we will move to the causes. So the etiology of the left main coronary artery disease, we have the obstructive, like atherosclerosis, plaque, or thrombus on unstable plaque, coronary dissection, type A aortic dissection and radiation, arthritis like syphilitic or Takayasu arthritis. We have vasospasm, external compression, the non-obstructive like congenital anomalies or aneurysmal dilatation, but the most frequent is the obstructive, which means the atherosclerosis. For the diagnostic, we have the clinical manifestation. First, we have the angina. A patient may experience chest pain or discomfort, often described as a pressure, squeezing, heaviness, or also the tightness. Dyspnea, which means the shortness of breath, especially with exertion, can be a prominent symptom of left main coronary artery disease. We have the fatigue, the syncope, myocardial infarction like a heart attack, and we have also the sudden cardiac death. In some cases, the left main coronary artery disease can lead to sudden cardiac death without warning symptoms, especially in individuals with significant blockages. But it is important to note that some patients, particularly those with diabetes or older adults, may present with atypical or even a silent symptom, making, of course, the diagnosis challenging. Therefore, a high index of suspicion is necessary, especially in individuals with risk factor for coronary artery disease. For the diagnosis modalities, we have the coronary angiography remains the primary diagnostic method for identifying clinically significant left main coronary artery lesion, serving as the gold standard in diagnosis. stress tests or specific electrocardiogram finding may also provide, of course, a valuable indication of the left main coronary artery disease. We will now move to the electrocardiogram. Studies indicate that the ST elevation in AVR is an independent predictor of the left main disease. As you can see here, the ST elevation in AVR and also the non-ST elevation acute coronary syndrome. Here we have the non-ST elevation. Additionally, the AVR-ST segment elevation may signal proximal left anterior descending artery obstruction. For the coronary angiography, we have in this picture an isolated and severe left main coronary stenosis. As you can see here, the severe left main coronary stenosis. Now I will share with you a video showing a severe disease in the mild left anterior descending artery. Okay. I will stop it here to see it clear. Okay. Here, as you can see, we have a severe disease in the mild left anterior descending artery. Okay, we will go back to our presentation. And we will talk about the treatment. There are three options for treating the left main coronary artery disease. First, an optimal medical therapy, percutaneous coronary intervention or surgical revascularization, like coronary artery bypass grafting. For the preventive and medical therapy, all the patient with a left main coronary artery disease should receive preventive therapy to decrease, of course, the risk of subsequent cardiovascular events. Preventive therapy includes smoking cessation, exercise, lipid-lowering therapy with statin, oral anti-diabetes or insulin, and achievement of target blood pressure goals with suitable anti-high hypertensive medication. I have another video to show you which explains the technique of a percutaneous intervention.
You see the blood vessel is narrowed by the fatty buildup in the wall. In order to treat this narrowing, we thread a tiny wire across it. Over this wire, we advance a long balloon and place it right across the narrowing. Inflate the balloon that expands the artery. We take the balloon out, and we advance a stent mounted on a balloon into the opening right across the obstruction. Inflate the balloon, expand the stent, then we deflate the balloon, take the balloon and the wire out, and we are left with an expanded, opened narrowing.
Okay, I hope that this video helped you to know more about the percutaneous intervention. I have also another pictures which show a stenosis of the left main artery disease here. And after the angioplasty, there is no stenosis, the flow is good of blood. Now we have the surgical treatment of left main coronary artery disease. Left main coronary artery disease is an important independent risk factor for increased mortality and morbidity at all stages of diagnosis and treatment of coronary artery disease. For several decades, coronary artery bypass graft was regarded as the standard of care for significant left main coronary artery disease in patient eligible for surgery. The coronary artery bypass ways for improving heart muscle oxygenation and reducing also the symptom of coronary artery disease. The blood vessel can be taken from your leg, saphenous vein, as you can see here, saphenous vein, or also inside your chest by the internal mammary arteries, or also your arm, radial arteries. We have here an image that shows the coronary artery bypass graft. And as you can see here, the vein removed from the leg, which is the saphenous veins, which is stitches to the aorta, and here's the aorta, and here the coronary artery. Here we have the internal mammary artery graft, which is also stitches with the coronary artery. So for the conclusion, the left main coronary artery disease is a very serious condition requiring careful management. While symptoms may not always be present, early detection and treatment are crucial to prevent complications like heart attack and heart failure. Thank you for your attention.